Hello, everyone. Just going to give everybody 1 second to come in. All right. Hello, everyone. My name is Bernadine Muvungu-Jeranyama. I am Senior Communications Associate at the National Association of Community Health Workers, or NACHW. Welcome to Session B, and that's Identifying and Addressing Vicarious Trauma Among Community Health Workers. With us today, we have two presenters. First is Denise Hernandez. Dr. Hernandez received her PhD from the College of Architecture, Planning, and Public Affairs in Public and Urban Administration at the University of Texas at Arlington. She earned her Master's of Public Health from the Texas A&M School of Public Health and a Bachelor of Science in Allied Health from Texas A&M University. Denise is the founder of the DFW Community Health Worker Association, for which she now serves as the Executive Director, as well as a member of the Founding Board of Directors for the Texas Association of CHWs/Promotores. She has also worked as a CHW instructor and ally for 10 years. Dr. Hernandez currently teaches in the graduate and undergraduate public health program at UTA and continues working to strengthen the support for the CHW workforce through research and policy. Presenting with Dr. Hernandez is Melissa Becerra. Melissa is a licensed master social worker in Texas and Missouri. She received her master's in social work from the University of Texas, Rio Grande Valley, and has over 8 years of experience working in the mental health field. She has provided therapeutic, case management, and crisis intervention services to a variety of populations. Through her work, she hopes to improve mental health access for minority populations and improve the stigma related to accessing those services. Thank you, and take it away.
Thank you so much, Bernadine. So my name's Denise Hernandez. I first want to say thank you for joining us today. I know there are wonderful concurrent sessions, and so we really appreciate your time. So the objectives for this session is to describe the causes and symptoms of vicarious trauma, explain the need for mental health support for CHWs, and identify the available mental health resources for community health workers. Now, we want to begin by doing a couple of poll questions just so you can reflect and use these questions as we move forward through the presentation. And so the first question, if you are a CHW, have you experienced or are experiencing the barriers currently faced by your community members? And if we can, thank you. And we'll have about 30 seconds for each session. Or each question, I mean. Okay, not surprisingly, the majority responded yes, right? That's one of the key characteristics of community health workers. So the next question, who here has sought mental health support from peers or a professional? Okay, 72% said yes, that's wonderful. We do have 22% that said no, and that's okay. And 6% said not applicable. And then the final question, do you think your work in the community has in the past or is currently impacting your mental and or emotional health. Yes, overwhelmingly, yes. 80% say yes. So thank you very much for answering those questions. And I think that gives us a good idea moving forward, and hopefully you can keep that in mind as we move forward as well. So as many of you already know, mental health or mental illnesses are among the most common health conditions in the United States. More than 50% of individuals will be diagnosed with a mental illness or disorder at some point in their lifetime. 1 in 5 Americans will experience a mental illness each year, and 1 in 25 American lives with a serious mental illness such as schizophrenia, bipolar, or major depression. But even though mental health problems are common, they can be managed if an individual has access to the appropriate resources and skills to cope with mental stressors. So mental health problems result from several factors, including biological, so genetic or brain chemistry, family history of mental health, and life experiences, whether it's trauma or abuse. And those individuals who have positive mental health, it allows them to really realize their full potential, to cope with the stresses of life, to work productively, and to make meaningful contributions to their communities. But for helping professionals, which includes individuals in healthcare and social work, education, counseling, public health, emergency response, and community outreach, for individuals in these professions, life experiences not only includes their own personal trauma and abuse. I just overwhelmingly, 80% of you shared you experiences the similar challenges as your community. And so not only are you experiencing, or not only are you living through your own life experiences, but now you're also sharing in those of your community members. You're exposed to the lived trauma and abuse experienced by the individuals that you serve. So helping professionals often find themselves providing emotional and practical support for their clients. I'm sure many of you have experienced that, been that mental and emotional support for your community. But and you end up developing this ongoing supportive relationship, but that can really impact your mental as a helping professional. So providing the adequate tools to help professionals can really better equip them for the potential mental and emotional strain of their work. We know that CHWs are trusted members of the community and are key members of our public health workforce. And community health workers are considered helping professionals. I think that's the nature of the CHW role. And because you are often members of the community you serve, this gives you a great insight into the needs of your community and gives you a better understanding of how to better serve them. However, it also increases the likelihood of triggering negative feelings in the CHW if the CHW has either previously or is currently still experiencing the same challenges. So the community health worker, again, we're known to be provide compassion care, and be understanding, but that requires empathy and kindness towards someone in distress. So, and the demands of helping work can cause compassion fatigue. Community health workers are at great risk of developing compassion fatigue as second vicarious trauma. And we saw in the poll results as well that you do feel like it causes some emotional strain personally as well. So although helping professionals feel a positive impact for helping others, we're in this field because we're passionate, we want to help our communities. The negative effects are associated with listening to others discuss their traumatic events. There is a negative side to that. And so again, research has shown that helping professionals can experience similar symptoms of those suffering from traumatic events. And helping professionals to experience vicarious trauma have higher rates of physical illness, higher turnover rates, and lower patient care productivity. And so I'm going to hand it over to Melissa now.
Okay. Hi, everybody. My name is Melissa. I'm so excited to be here to discuss a really important topics, because we're not just talking about one thing. We're talking about mental health, and on top of that, the quality of life that you have as a professional. So throughout the presentation, I'll be saying the word helper, which will refer to you as a helper providing helping services. So just keep that in mind. I will discuss some brief definitions like burnout, vicarious trauma, compassion fatigue, and compassion satisfaction. But this all plays a role in something that Denise will discuss toward the end of presentation, called the Professional Quality of Life Questionnaire, or the PRO-QOL. So we'll be saying professional quality of life a lot, but we'll discuss why at the very end of the presentation. But yeah, let's get started. So professional quality of life is the quality one feels in relation to their work as a helper. So as community health workers, you are a helper. You provide lots of services to a lot of different community members. So under this big umbrella, we have compassion satisfaction and compassion fatigue. So as Denise mentioned, there are both positive and negative aspects in being a helper, right? And so the positive is going to be the compassion satisfaction, and then the negative will be the compassion fatigue. And so I'll explain those in the next few slides. Under the umbrella of compassion fatigue, we have burnout, which I'm sure a lot of you have heard of or even probably experienced. And then we'll also discuss vicarious trauma, which is also known as secondary traumatic stress. For the sake of this presentation, we'll call it vicarious trauma. But if you can, try to take like a little snapshot of this in your mind, of this little diagram, because we will kind of talk about how each of these components impact one another and impact you as a helper as you provide services to community members. So this is important to discuss because research has shown that if you experience compassion fatigue, burnout, or vicarious or secondary trauma, it has led some people to develop mental illness or mental disorders. And so with compassion fatigue, for example, if you experience vicarious or secondary trauma, it can lead to anxiety disorders, mood disorders such as depression, or even post-traumatic stress disorder. It is important to note that the DSM-5 came out, I believe, around 2014 or 15. And so in that, when they revised it, they actually changed it to where if you experience indirect trauma, that actually would classify as getting diagnosed with PTSD. And so that was huge for just the diagnosis in general of getting diagnosed with PTSD. So it doesn't just have to be you directly experience the trauma yourself. Now, if you witnessed or heard of someone's trauma, that even can classify as a symptom of PTSD. And secondly, burnout, which is under the compassion fatigue umbrella. With that, if it's prolonged and not addressed, it can lead to anxiety, depression, and even hopelessness, which is a big red flag when it comes to suicidal ideation or just suicide rates. And so these are very important and scary things to face, especially alone. And so we want to discuss the importance of that, addressing it, and how you can treat that as well. So let's start off with the positive aspect of being a helper, being a community health worker, and working in the helping profession. So compassion satisfaction refers to the pleasure derived from the work that you do, including feeling positive about the meaningfulness of your contribution to the work that you do and to the greater good of society. You provide healing, encouragement, and support to others who are facing anguish. So I know that as a CHW, a lot of your community members and clients probably maybe after a session or after a meeting, they'll come to you and really just kind of just unload everything, right? They trust you, they see you as someone that they can kind of open up to. You're relatable, you're trustworthy. And so that, you know, if you don't have compassion for what you do, I mean, you're going to get burnt out quick. And so, I mean, CHWs really go with their heart on their sleeves. And so I feel like a lot of your clients will open up to you all. And so that's great. But when that happens a lot, that can lead, and if you don't know how to kind of process all those emotions, especially if it's trauma related, it can lead to compassion fatigue. So compassion fatigue is a combination of physical, emotional, and spiritual depletion associated with caring for others who are in significant emotional pain and physical distress. So being affected by your work is pretty normal for any caregiving profession. But when the feeling becomes really overwhelming and it starts impacting your well-being, your sleep, your eating habits, and a lot of different areas of your life, that's when you're experiencing compassion fatigue. It is just an overwhelming feeling. You feel like some people have reported feeling like numb. They just kind of feel apathetic to what they're doing. They just are running on empty, so much that, I mean, they're about to just give up. So we definitely want to avoid that. And one second, let's go to the next slide, the compassion fatigue triggers. So these are triggers or causes of compassion fatigue. So some examples of this are going to be being physically or verbally threatened when providing care in dangerous environments, specializing in providing care for those experiencing death, grief, and bereavement, which I know a lot of CHWs also do. Providing care under a heavy workload, excessive demands, or long hours. I know in the social work field that is very common, so I can definitely relate to that. And then providing service that requires you to visit accident scenes, view graphic evidence, or deal with evidence or reports of trauma. So all these are just a few of the triggers or causes that could eventually lead to compassion fatigue. And so over a period of time, if you're constantly experiencing this, it could definitely lead to compassion fatigue. But for some people, it may just be that one time where they're verbally or physically threatened, that they're just like, I'm done. Like I'm done with this. I'm tired, you know, and they just are burnt out or develop that vicarious trauma because of that one event. Some signs of compassion fatigue are going to include feeling angry, irritable, and just have a lot of physical tension. A big one is going to be feeling less empathetic toward others. You know, empathy means putting yourself in someone else's shoes, right? And so feeling what they feel. So when you're not capable of doing that anymore, where you just are tired of that, that's a huge red flag for compassion fatigue. Limited tolerance for stress, changes in your belief system, reduced sense of accomplishment, difficulty concentrating on your job duties, difficulty sleeping, nightmares and flashbacks, which is a big one for vicarious trauma, increased isolation, especially at work, poor coping skills, conflict in relationships, not just at work, but even in your home life and relationships with others, self-blame for situations out of your control. So some of this, yeah, are pretty, you know, not common, but, you know, sometimes we experience these symptoms whenever we just have really heavy work. But again, if you experience this and you're just really overwhelmed and it's been going on for quite some time, I mean, it's a huge sign that you're experiencing compassion fatigue. So let's move on to the next slide. And before we talk about vicarious trauma, I want to talk about what is trauma. So trauma results from exposure to an incident or series of events that are emotionally disturbing or life-threatening, with lasting adverse effects on the individual's functioning and mental and physical, social, and or spiritual well-being. So some traumatic experiences that are traumatic could be physical, sexual, emotional abuse, childhood neglect, living with a family member with mental health or substance abuse disorders, sudden or unexplained separation from a loved one, poverty, racism, discrimination, and oppression, and violence in the community, war, or terrorism. So it's important to note that, you know, there's a huge amount of the people that you work with have experienced trauma in one way or another. And so it's just important to recognize that when you are out there in the community, because you just never know who you're gonna come along with that you might, not necessarily trigger, but there may be some topics that may be, that may be, I guess, triggering for them. And so it's important to know how to define trauma and understand what are different components of trauma. Like, for example, the racism, discrimination, and oppression, the poverty. A lot of times when we think of trauma, we think of like an accident or physical abuse, child abuse, things that are very like overt in your face. When in reality, like poverty is a huge one. That is traumatic. So in a lot of the communities that you serve, a lot of these people have experienced traumatic events in their lives. So through with vicarious trauma on the next slide, as I mentioned, this is also known as secondary traumatic stress as well. It is an occupational challenge for people working and volunteering in the fields of victim services, law enforcement, emergency medical services, fire services, and other allied professions due to their continuous exposure to victims of trauma and violence. And so we'll even see this in education as an increased amount of teachers. They're the first ones sometimes that will notice the abuse or neglect of a child, or even being told that they're being abused. And so through that, they may experience some of that secondary traumatic stress by hearing some of the kids' stories, or even being maybe attacked by a parent verbally, by, the teacher having reported them to Child Protective Services. And so we see a variety of occupations, not just, like doctors or law enforcement, emergency medical services. There's a variety of occupations now that experience this vicarious trauma or secondary traumatic stress. It is important to note that with vicarious trauma, one of the main components of it when someone experiences vicarious trauma is that their worldview or their mindset shifts. For example, if someone works at a domestic violence shelter and they're constantly experiencing or hearing these stories of trauma of these men abusing these women, they may feel like they just can't trust any man out there. Or same thing with a child protective services worker. They may start to feel like really overprotective of their own children because of the work that they do. And so with vicarious trauma, a lot of just their mindset starts to shift because of the work that they do. And so that's huge, to have the work impact you so much that your belief system is altered because of what you're doing every day, day in and out. So that's it's a big one for vicarious trauma, a big symptom of it. And I'll talk about some other ones in the next slide. So some emotional symptoms of vicarious trauma include anxiety. We talked about that, just feeling on edge, feeling sad, irritable, angry, distracted, and then also having changes in mood. Some behavioral symptoms include isolating yourself, substance use. That's a big one because, they're learning to cope with some of the trauma that they heard about. Sleeping and eating changes, and work-home difficulty. So that work and home life balance is definitely impacted with like isolating yourself. Physiological symptoms include headaches, rashes, ulcers, heartburn, among others. So with physiological changes, I know that ulcers is a big one that's stress-induced, and so you see that also with the vicarious trauma. Cognitive symptoms, cynicism is a huge one. So just being overly negative and just being apathetic again, not really caring anymore. You're drained. Negativity, avoidance, and rumination on the trauma. So constantly thinking about the trauma that you heard about or witnessed. And then some spiritual symptoms include loss of hope, decreased sense of purpose, disconnect from others, and feeling unworthy of love. And I will say, when I first became a social worker right out of grad school, I worked at a counseling center at a university. And I often encountered people or students who had suicidal thoughts, many who had plans and, verbalized that they were going to hurt themselves or, take their own life. And so it was very hard as a new graduate to take all that in. I don't think in school they prepared us enough to deal with vicarious trauma or to learn about it and to just know who to go to if you start to feel these symptoms that are in front of you. So often I would go home and just cry and be like, I'm really worried about my patient. Like, I don't know what they're going to do. I would often reach out to my supervisor and tell her I was worried, and they would try to reassure me that it was fine. We did a safety plan. It's going to be okay. But my mind still raced and ruminated so much on the thought of, are they okay? Are they going to hurt themselves? Are they in the hospital? Have they taken their own life? And so a lot of them came with stories of trauma, and just hearing some of those stories was just heartbreaking. And so it was just really, that first, I would say the first few years out of grad school were really difficult, and it was really hard for me to really balance out that work and life balance. It was hard for me to disconnect from work. It was often on my mind. And so I questioned, like, why did I even choose this profession? Why did I go to grad school? Like, what am I doing with my life? Like, this is really heavy stuff. And so it took a couple years to finally, and through assistance from supervisors and colleagues, to just really get a handle on that. And you'll never get used to it, but you learn how to cope with those situations better as you become more experienced through your work. So just wanted to share that. If some of you have experienced that throughout your work as a CHW and have assisted people, whether it was through food or just listening to them, they're leaving an abusive situation, or maybe they're undocumented and had a really rough journey on the way to this country, whatever it is, whatever traumatic experience it is, if it's impacted you, that shows that you have compassion, but also you have to know how to use coping skills to not let it affect you to where it gets to you experiencing vicarious trauma. So we'll go on to the next slide, how to address vicarious trauma. So physically and behaviorally, you obviously are the basics that everyone always recommends. So exercise, being physically active, having a good sleep hygiene, so sleeping 8 to 10 hours each night, eating healthy, taking necessary medications, limiting alcohol, drugs, and smoking. So you often hear those. I'm sure you know them by heart as a CHW. Those are things to kind of keep you healthy and straight. Emotional and relational ways to address vicarious trauma are going to include seeking support, and that could be through a therapist. So I was so happy to see that 70% of you said that you have accessed mental health support, whether through a colleague or through a professional. So that is amazing. So I'm glad that that's a big source of support for you all. Spending time with loved ones and engaging in hobbies is a big one. So just engaging in pleasurable activities is a good one. And then cognitive ways to address vicarious trauma are going to be focusing on positive thoughts, affirming your strengths, doing breathing techniques and visualization exercises, reminding yourself that this is temporary, and staying in the present moment. And so I will say right now, cognitively, there's a big movement with mindfulness. So mindfulness is really huge right now, and rightfully so, because it is very, very helpful in helping you stay in the present and really not letting your mind wander to this situation or that situation that's causing you anxiety or sadness. It's helping you just focus on the present moment and keeping you grounded. And so if you have time, look that up, mindfulness. And then spiritual ways to address vicarious trauma. So participating in a community that you value, or praying and meditating. Those are big ones. So we'll go on to the next topic, which is burnout. So I'm sure a lot of you have experienced this one way or another, just feeling really exhausted from work, right? And so one way to differentiate exhaustion from burnout is that being exhausted is just it's a normal response to stress, right, and to just a regular work day. With burnout, as the definition says, it's a state of physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding situations. So that's a mouthful. So burnout is a big deal. I know sometimes we use it to just kind of say, I'm burnt out, this, that, but it's a big issue that affects mental and physical health. So a big component of it is dwindling compassion toward those in their care. So again, burnout is under that compassion fatigue umbrella. So you will see some dwindling compassion there. Feeling like you can no longer do your job effectively. Cynicism again, anger and frustration. We saw the cynicism also under the umbrella of compassion fatigue. And then another one, this one is kind of normal for some of us, dreading going to work. But I mean, with the burnout, it's like a constant, like you're struggling to get out of bed. Your mind is just telling you like, what are you doing? Like, it's just a constant weight on your shoulders. And I don't know, if you experienced it, regular, like I don't want to go to work, compared to, I just don't want to go to work. Like, what am I doing? So just a constant dread. And let me see some statistics on burnout. I believe these stats just came out I think February, a couple of months ago. So overwork and burnout contributed to more than 745,000 deaths worldwide in just 1 year, according to the World Health Organization. People working 55 or more hours per week have an estimated 35% higher risk of a stroke and 17% higher risk of dying from heart disease. And then over 60% of employees suffer from workplace stress, costing $190 billion annually in healthcare costs. So is it a big deal? Yes, definitely. Is it addressed often in workplaces? No, it's not. So it's definitely something that we are very passionate to talk about today as well, alongside the vicarious trauma. And so we just definitely want to throw these stats out there because it's a real thing and a lot of you all are experiencing it. I think you said, 80% of you said that your work has impacted your mental health. So 80%, you're not alone. A lot of this needs to be addressed with a lot of, through yourself and through some organizations. So treating burnout, what are some things that you could do? So evaluating your options. So the first one I would say, if feeling burnt out, is talking to a supervisor. That's probably the first thing that someone should do if it's gotten that bad. Discuss specific concerns with them, maybe try to work together to change expectations or reach compromises or solutions to try to help you perform better or just feel better. Try to set goals for what must get done and what can wait. So prioritizing your work and just setting a plan each morning when you get to work and seeing if that helps. Seeking support. Again, I know some of you have said that you seek support through colleagues or through mental health professionals. So that's really important. Reaching out to loved ones, friends, support and collaboration might help you cope as well. And if you have access to an employee assistance program or EAP, definitely taking advantage of that because they offer free counseling sessions if your company does have that. Try a relaxing activity. I know sometimes, that will probably only just take away some temporary feelings of burnout, but definitely can help just relieve some of that stress and tension in that moment. Getting some exercise, getting some good sleep, and like I said, mindfulness. That's a big one right now. And if you do seek therapy or are receiving therapy, you probably more than likely have heard the word mindfulness. And so that is also very helpful. So again, these are just some very in the moment ways to treat burnout. Burnout is a much larger issue than just, than addressing it this way. There is a measure called, I think it's the Maslow measure for burnout. And in it, there are 3 things that it measures, and it's emotional exhaustion, which is a big sign of burnout. Depersonalization, which is just having an uncaring feeling and hostility toward your clients or your colleagues. And then another component of it is reduced personal accomplishment. So feeling that you're not accomplishing anything worthwhile at work, which can lead to poor motivation and poor work performance. So definitely those 3 things: emotional exhaustion, depersonalization, like just not caring and being apathetic, and reduced personal accomplishment at work are 3 big red flags for burnout. So let's talk a little bit about social work, because through our work and through Dr. Hernandez, we found that people who work in social services, we kind of have similar job duties as CHWs, right? We're in the community a lot. We help a lot of people who have been through very difficult situations, and we really just have a compassion for helping them improve their lives one way or another. So in social work, let's see how much these stats on vicarious trauma and burnout affects the social work profession. So almost half, about 47% of mental health social workers in this study were surveyed on job satisfaction and burnout. They showed significant symptomology of a potential psychological disorder, which was twice the level reported by similar surveys of psychiatrists. And I believe in this study it was depression and anxiety, primarily those 2 that they saw a huge increase in mental health social workers. And then on top of that, you see, so many thousands of studies on child welfare workers and how they experience burnout daily, how a lot of them are leaving the workforce. And so I actually grabbed the statistics on the U.S. Bureau of Labor Statistics estimates 1/3 of social worker job separation, so people leaving the field between 2016 and 2026, will be attributed to people transferring out of social work to other occupations. So in our own profession, people are leaving in droves. I mean, it's bad, you know, and I know our profession has had kind of that reputation where, you know, there's a lot of us that are burnt out, you know, it's hard work, really, really hard work. And you see that in what's happening, you know, the labor statistics estimates that 1/3 of social work separations are going to be attributed to people leaving just the field in general. So a lot of work needs to be done. We definitely pour out a lot to our clients and patients when a lot of organizations and agencies and companies don't really pour back into the social workers. And I hope that changes pretty soon, because the mental health field is growing significantly, and I believe 60% of workers in the mental health field are social workers, so we make up the majority of mental health professionals. So it's important that this issue is addressed, burnout, you know, high caseload, stuff like that. Similarly, in the medical field, we have some stats here. In 2011, a national study said that approximately 45% of U.S. physicians met criteria for burnout, so almost half that they surveyed. The rate increased to 54% in 2014, so it jumped up significantly. And then physicians also reported lower rate of satisfaction with work-life balance in 2014 compared to 2011. So the rates are just getting worse for physicians and medical professionals. So how does this impact you? So burned out doctors are more likely to leave practice, which reduces patients' access to and continuity of care. So again, same as social workers, a lot of people leaving the field. They threaten patient safety and care quality. That's happened. Depersonalization, we talked about that with burnout, so leading to poor interactions with patients. They're kind of detached. They just don't care anymore. And they have impaired attention, memory, and executive function, which can lead to increased medical errors. So a lot of big ways that burnout can affect medical professionals. So a lot of research studies on them as well. And then for my last slide, what are some mental health resources for helping professionals? So one big resource for our profession as social workers, which I believe you all do too. I know Denise was one of the founders of the Dallas-Fort Worth Community Health Worker Association, which I know is a huge resource for a lot of CHWs in the Dallas area. A lot of these associations provide different resources like webinars, maybe support groups, or just maybe even like a happy hour where everybody can just kind of go and socialize and network, and just getting out and really getting that time to relate to other CHWs is really important. Another one is support groups with colleagues. Again, I know that social workers or even CHWs maybe that work in oncology, so working with patients who have cancer, having support groups or just groups for these professionals who are constantly, you know, working with really difficult situations, can have that time to themselves to really just debrief really hard days and things like that. And so I know that in the mental health field, whenever we had a mental health or a crisis, we would all get together after the crisis was handled, and would just kind of discuss it and just kind of talk about it and see if anybody needed help. So those are good ways to kind of de-stress in a way with your colleagues. Take a mental health day. I know a lot of companies have started mental health days, which is awesome. Or take some vacation time if you feel like you need to take some time off to address any mental health concerns. And then employee assistance programs, EAPs. So a lot of companies have this and some don't. I think it's great because it does offer free counseling to employees. Sometimes it'll be about 6 to 8 sessions, and they're very, very helpful. And so you might want to ask your organization if that is something that you guys have as a benefit. And then lastly, seeking assistance from experienced colleagues or supervisors. I know that that is what made a huge difference for me as a new social worker out in the field, dealing with really heavy stuff. I was talking to more experienced social workers or therapists and counselors, and just kind of venting to them and asking them for advice, and them just pouring back into me and saying, hey, it's going to be okay, it gets better, like try to do this, try to do that. Even just having them listen to me just vent was really helpful. And then having good supervision. If your supervisor is someone that you look up to and have a good relationship with, just talking to them and saying, hey, like, I'm struggling with this client or this patient, I'm struggling with this group that focuses on domestic violence because I experienced that. Or, if you relate to some sort of topic or group and it's hard for you to present that material, definitely talk to a supervisor and see if someone else can cover that. So those are just some couple of ways that we can provide support for helping professionals, specifically you all. And so I hope this was helpful. Again, we're talking about professional quality of life, compassion, satisfaction, the positive aspect of helping, and then compassion fatigue, the negative aspect of helping, which includes burnout and vicarious trauma. I hope you enjoyed that and got, not necessarily enjoyed, but really took something helpful from it. And I'll let Denise kind of talk a little bit more about how CHWs are impacted and talk about the pro-QOL, and then she'll also offer some self-care tips at the end of the presentation. So thank you all, and I'll hand it over to Denise.
Thank you so much, Melissa. So there is so much that we can learn, or the CHW field can learn from other helping professionals. A lot of things that we can do to advocate for our CHWs. So all of this information is not necessarily to discourage you or try to scare you away from the field, because we know community health workers are so important and so essential to improving the health of our most underserved communities. And so what we want to do instead is bring attention to the topic so that we can better equip our CHWs, we can advocate to our employers and to our organizations to support and prepare the CHWs. And so I want to touch on a little bit some information that we found on the impact on CHWs. So again, the work overload and personal relationships with community members can just lead to overall compassion fatigue. A lot of that is because of the excessive exposure to that secondary trauma that Melissa talked about. About 50% of organizations noticed mental health symptoms among CHWs, and this was a global assessment of organizations that work with CHWs. And of those 50% organizations that noticed mental health symptoms in their CHWs, only about half of them were able to provide resources to them. Another study by the World Health Organization found that CHW turnover rate can be as high as 50%. So you have a 50-50 chance of staying in the field. And of course, again, we want to do whatever we can to avoid that and provide you with the tools and resources. And so again, contributing factors for CHW burnout, workload, work overload, lack of care team integration, lack of proper supervision, lack of autonomy, lack of consistent training. And so some of you may have seen this survey. I believe it was shared nationally as well, but recently the COVID-19 pandemic has affected everyone's mental health one way or another. And an assessment was conducted with Texas community health workers to determine the impact of COVID on their, just on CHWs in general. And so as you can see from this graph, it depicts the personal impact of the pandemic on the CHW. You'll see that almost 50% of respondents reported that COVID was a major threat to their personal lives. More than 40% said the pandemic was a minor threat to their financial and job security. And that's probably because that's when we're being called, the CHWs are being called to work. But almost 60% reported COVID being a major threat to their day-to-day life in their communities. The feelings of professional burnout were also assessed using the professional quality of life scale. And you see here that while most of the respondents did rate their level of burnout as low, we cannot ignore the 36% that identified it as moderate or high. That's more than 1/3 of the respondents. So that's still a significant amount. And so, you know, helping professionals whose job it is to help others are often hesitant to ask help for themselves. And so this hesitation can be largely due to the stigma surrounding mental health and burnout in the healthcare field, as well as sometimes, you know, culturally, there's a stigma behind that as well. We need to keep in mind that individuals who work to help others tend to disregard their own care. That's common for moms also, right? We're so worried taking care of our family that we often overlook our own health. That goes for the helping professionals as well. And also helping professionals sometimes don't want to admit that they're burnt out because they feel like it might contradict with them wanting to help others. So in the same survey, community health workers were asked about the most concerning issues faced by their community. And you'll notice that some of the issues that were mentioned were loneliness and depression. Of course, along with food access and contracting COVID, but loneliness and depression is also being experienced in the community they serve. And so again, going back to that vicarious trauma, they're helping people who are already depressed and facing these challenges. Unfortunately, there are very limited resources and very limited information about the mental health impact on community health workers. The literature focuses on equipping CHWs with mental health resources for their community. Right, we know CHWs are great at improving health education and preventative health behaviors. And so a lot of the interventions, a lot of our community efforts focus on that, how to incorporate CHWs to improve the health of their community. However, we also need to focus and devote more time and resources to learn about how the mental health of CHWs is being impacted by their work. So I'm gonna go over some tools and strategies that we can use with our community health workers. I know Melissa touched on some, and these are more so some that either my organization has started incorporating or some that that can be useful for our CHWs and organizations. So again, we mentioned the professional quality of life scale. This is specifically designed for helping professions or helping professionals. It asks questions to assess how your experiences helping others has affected you both positively and negatively. So everything that Melissa just touched on, right? And so here's that flow chart again. And so the assessment focuses on compassion fatigue and compassion satisfaction, and underneath compassion fatigue, it gives you a score for burnout, vicarious trauma or secondary traumatic stress, and compassion satisfaction. And so when you get your individual scores for each of these constructs, it really paints a picture of what the person is experiencing in their jobs. It can be used to track the individual's compassion satisfaction over the period of their employment or their community outreach, if there's a specific project. This is not, however, a medical test. It is focused on understanding the positive and negative aspects of helping. It can be viewed as a screening tool. It can be a guide in regard to an individual's or organization's balance of positive and negative experience, related again to doing their either paid job or whether it's a volunteer job as well. We often rely on our volunteers for a lot of this boots on the ground work, especially after, for example, a natural disaster, where they can be exposed to a lot of physical trauma as well as other mental trauma. And so again, we can't forget our volunteers. So the professional quality of life scale helps with providing a platform for change. Again, it can be a way to just start exploring what the environment is like in your organization, in your employer. And so you can self-administer at a regular self-determined interval. Maybe you say, okay, at the beginning of this year or at the end of the year, how was this year? Reflecting on this year, how do I feel about my work? And use that to equip yourself with tools for the following year. Again, the scores can be, the scores are consistent, or the tool is consistent. So scores across time reflect change in the person, not in the measure itself. So if you do it maybe at the beginning of the year and halfway through the year, you might be able to see if there's a change and be able to adjust as needed. And it allows opportunity to just, again, reevaluate and adjust your self-care plan. The assessment can help with resiliency planning. It can help you plan where to put your energy to increase your resilience. It can help organizations find ways, again, to maximize those positive aspects, identify what are the negative aspects and how to mitigate those. And it can be used as information for discussions, for supervisors to form those discussion groups, those support groups. Other support strategies that I've seen used with our CHWs in Texas, one thing that our organization in Dallas-Fort Worth is incorporating is a mental health minute. So our members meet quarterly, and at our quarterly member meetings, we always start off with a mental health minute, and Melissa comes in and gives us some sort of mindfulness exercise. We've gone through grounding and deep breathing, and so she walks us through what those are, how they benefit you, and just we do it together. And so that's one way to do it, just education in general. Again, not only for them to take to their community, but for themselves as well. Peer support groups. This is something that a wonderful group in San Antonio, Texas started doing with their CHWs throughout the pandemic, is just let's get together weekly, talk about what you're seeing out in your community, just as a way to vent and just share what you're seeing, maybe exchange ideas and resources, but really more of just an open environment where they can share their personal experiences with other people who understand the nature of CHW work. We also want to allow CHWs to spend time volunteering, maybe at the community resources to which they refer people. And so if they're referring individuals to a local women's shelter, maybe having them spend time at the women's shelter can help them just better prepare themselves to support the individuals if they spend that time volunteering, or maybe somewhere that's more lighthearted to just kind of lighten the mood a little bit if needed. Another thing that our association has been doing locally is reflection logs. These allow supervisors to track how CHWs are improving in their practice and they help manage employees' burnout and stress. So the reflection logs can be very empowering. Some of the questions or topics that are asked in the reflection logs, of course, these can be tailored to meet your needs. So we do it after an event, and so identify some of the successes of the event, some of the challenges or goals that were not met during the visit. What interactions stood out to you, whether positive or negative? Were there additional resources that you need? What are some proud moments at this event? What were some stressful interactions? And so again, after each event, we have our CHWs complete this, and it helps us as the association better prepare our CHWs and better equip them to go out into their community and serve the community. And so I can share our log if anyone is interested, but also a shameless plug, we're going to discuss these more in detail during a session tomorrow. All of these resources and some additional ones. The session tomorrow is titled Mental Health Resources for CHWs. And so if you want to see more detailed information about that, feel free to join us then. Self-care plan. You know, in the way you live your life can have a big impact on your health, your well-being, and how well or poorly you manage stress. And so doing just an honest reflection and assessment of how well or poorly you take care of yourself in these different areas can really help you create a plan for yourself in case you face stressful situations in the future. And so there are self-care assessments already available, and again, I can share those as well. And it really takes you through each of these different areas and ask questions to assess how you take care of yourself in these different aspects, and you can really pinpoint where you need to devote more time. To conclude, I do want to say that we all know that we need more advocacy, but community health worker organizations, employers, and allies have a responsibility to provide community health workers with the tools, the skills, and support needed to conduct their work effectively. We need to advocate for ourselves. We need to advocate to our CHW organizations, our employers, and just not forget that we also need to nurture the nurturer, right? And so thank you all for your attention. I think we have maybe 2 minutes left, but if anyone has any questions, I don't know if we have time for questions. Here is my contact information as well as Melissa's. Feel free to reach out if you do, if you're interested in learning more or if you have any questions.